Welcome to the Dental Forecast. Join Dr. Craig Packer, Dr. Joe Field, and their incredible guests as they expand on the Gen 4 commitment to usher in the next generation of dentistry. Stay with us as we delve into cutting-edge techniques and discussions shaping the future of dental care, right here on the Dental Forecast.
Welcome, everybody, to another episode of the Dental Forecast. I'm Dr. Craig Packer, along with my co-host, Dr. Joseph Field, and we're excited for another episode of the Dental Forecast for you today. And Dr. Field, you're going to go ahead and introduce us to our guest for today.
So we wrestled our guest today away from a very, very busy schedule, both traveling and other demands. Super happy to introduce Dr. Dan Butterman, who is the new, as of January, the new Chief Dental Officer at Spear Education. So, Dan's been involved. I'm sure you guys all know Dan, or Dr. Butterman. He's been involved with CDOCS before that since 2019. He was the faculty chair at CDOCS in 2023. He's been very involved in education. In addition to that, maintaining a private practice in Centennial, Colorado. So very inspirational to watch what he does and how committed he is to dentistry, both from a patient care standpoint and certainly from an education standpoint. And we got to spend some time with Dan at the Spear Summit in March, which was fantastic. That was Dan's first one as the Chief Dental Officer. He did a fantastic job, Dan. You nailed it.
Thank you.
So really excited to have you on the podcast with us today. Hear what you have to say for our dentists, share what's going on in your world and how it relates to how we're practicing dentistry. And I think a lot of people are going to get a ton of value out of this. So thank you for your time.
Oh, I appreciate it. Thanks for having me on. It really is an honor. I think you guys are such wonderful partners. You have such a great group. So I'm really excited to be able to at least talk about some of the stuff that we're doing and maybe share a little bit of the gray hair wisdom that I've developed over the years.
Well, I would love, Dan, if out of the gate, if you wouldn't mind, just give a little bit more detail on your history and why and how it is you got so involved in education, first with CDOCS and all the other lecturing that you do. Why? You're a very successful dentist. Why did you do that?
That's a really good question. My wife seems to ask me that very often, especially the more I travel. But I've been practicing clinical dentistry for 31 years. And I have to say that lecturing, speaking, teaching, that was never on the radar for me. And it was one of those things where I was a little bit of a CE junkie. I loved learning all of this stuff. And I kind of got hooked on a lot of different programs. And then it sort of started with CAD/CAM, actually. I bought my first CEREC unit back in 2010 or 2011. And I started going through study clubs, watching videos, and started coming up with some concepts. And then somebody said, "Hey, do you mind coming out into speaking at a study club?" And I'm like, "Okay, that'd be really fun. I've never done that before." And it was like after that first time when I was kind of able to share and saw those light bulb moments go on for some people, I'm like, "Oh my God, I actually love this." And it just kind of became addictive because anybody that teaches understands that if you don't love it, then you got to get out. And it's really a hard gig, but it's like the idea of being able to take somebody that is struggling a little bit and be able to see that moment when they get it, and it does something that doesn't just touch the doctor that's teaching or that's taking the workshop, but it kind of touches every patient that they see moving forward as well. So I love that piece of it. That's how I kind of got pulled into it and just kept doing more and more. And I came in on the CDOC side and really focused heavily on CAD/CAM design, everything from crown bridge to anterior aesthetics. And then I also moved a lot into the implant side. I did my implant training with Carl Mesh many years ago, and I was fortunate enough to be able to work with a couple different implant manufacturers on the R&D side. So I got to understand that piece of it. And it just became another tool in my tool belt that, hey, what if we put all this together? What if we talk CAD/CAM? What if we talk implant planning and surgery and so forth? And it just kind of grew from there. And I guess my biggest issue was that I'm not very good at saying no. And so I kind of got pulled further and further along, faculty chair, and then into Chief Dental Officer, which has been really, truly an honor and a privilege to be able to do.
As you know, Dan, we love Spear Education. Joe and I both love it, but we were both there at Summit, and that was amazing to be there and to experience that and to be among so many doctors who who have drinking the Spirit Education Kool-Aid, I guess, like we have. I first started going down to the Scottsdale Center. It's probably been 15 years ago or so now, when Frank was doing a lot of the teaching. And I think that was when Greg was actually pretty new and joining. I don't remember what year he came in, but he was pretty new in that down there, and have been part of study clubs and everything, ever since. And then, of course, with our enterprise level connection contract that we have with Spirit Education, we now have 230 or 40 doctors, all having the access to Spirit Online and study clubs and all those things, CDocs, everything that you offer for us. And it's been huge for us as a company, and we love it. And your team that we interact with, by the way, is amazing. We should probably call out like Amy and Amanda and that group that they're incredible.
Yeah, they really are.
One of the things that Spirit Education has taught me, and I'm sure you were already doing this on your own before, is comprehensive care and interdisciplinary care. Those two things, I think, have just level you up from just coming out of school and just doing single tooth dentistry. So how did that work for you? And I guess now that you have a son who's been a dentist for 1 year and you're mentoring him and helping him, how do you see that transition from coming out of school and, maybe doing a composite on one tooth to being able to see the entire body system? It's not even just oral health anymore, right? We're looking beyond that even now. So I guess give us a feeling of that sequence, or that travel through that career that you've now been practicing for 31 years.
It's funny, Craig, that you said see it, because I think that's really what it comes down to. You almost forget when you've been practicing for a number of years, you forget how many times you got punched in the face. You forget the pain that you went through in those first 5 to 7 plus years as you start to learn what you don't know. And it really is, it's truly a treat for me having my son Kevin in the practice, and he's sort of kind of going through all of that transition right now. But as you know, when you graduate dental school, you're very tooth specific. When we talk about diagnosis and we talk about treatment planning, it really is all about teeth and not the patient. And it's a completely different way of looking and seeing things. When you go from looking at a tooth and saying this needs a filling, this needs a crown, et cetera, to let's just take a look at the patient's face. Are the teeth in the right place? And whether there are airway issues, whether there are other systemic problems that are a part of it, like those are the kind of things that they don't enter into your mind if you don't learn how to see it. And so when we start talking about interdisciplinary, I mean, this is stuff that still happens to me every day in my practice. Somebody comes in, I think you've all had this, patient comes in and says, hey, I would love to make my front teeth look nicer. Okay, great. We would, our heart rates go up. We get excited. Would you like to do veneers? Yes, I would like to do veneers. Great. I'm all in. But that's when we need to start thinking and stopping. And if we don't understand where those teeth are supposed to go in the first place, how are we going to get a good result? And if the teeth aren't in the right place, are we going to be able to do it surgically by grinding on teeth, or are we going to have to do it orthodontically? And if we do it orthodontically, is the tissue going to end up in the right place? And, one of the things that I think Spirit does so well is it teaches you to step back and put the handpiece down, right? Like we're all anxious to go, but it's important that we have a really good game plan first. And you guys are the quarterbacks. We have to understand, what is the expectation that the patient has? What are we able to achieve? And it doesn't mean that every case needs to be interdisciplinary. That's not what I'm saying. There are many that can be handled, but they should at least be discussed. And these are options that should be laid out on the table. And I think Spear helps you kind of take that digital approach as well, where we can take a photo of a patient. Because if you tell a patient, how many of you guys, and I would imagine both of you for sure, and most of your team have said to a patient, hey, I think it'd be a great idea to do orthodontic treatment before we do this restorative treatment. And like, what's the answer? Sign me up today, doc. Like, I'm ready to go, right? It's never that. Like, there's no chance. It's always like, absolutely no, because patients are very visual. And oftentimes when they say no to orthodontic treatment, they don't really appreciate what they're saying no to. They don't understand the repercussions of that. So in order for us to see it, that's step one. But then we have to be able to help the patient see it and help the patient understand it so that they get it. And we can help them say yes to these more comprehensive cases. But part of that comes down to not just educating the patient, but educating yourselves so that you can really take a look at the patient more than just a single tooth type of treatment.
So Dan, as you taken on your role, and by the way, filling pretty big shoes there with Steve, who ran the show for a while.
Maybe because he's so tall?
Well, that too. I mean, he's got big feet. But would you say, well, I guess I don't want to put words in your mouth. What is your vision with spear education? And is this it? Like, what do you see the next 6 months, year, 5 years looking like at Spear?
Yeah, the thing that, and let me just give it to you from a personal perspective first. In all the years that I've been teaching, I've never been done with a lecture. It always evolves, it always changes, it always matures as we do, and it always becomes better, hopefully better over the years. And I think that it's really important that Spear Education does the same. It's not okay to just say, hey, these are the workshops that we've been teaching for the last 10, 15 years, and they're successful, and let's just keep using the same slides and keep doing the same thing year after year. They have to evolve, they have to grow, simply because dentists learn differently now. Procedures are different. Now all the way we interact with patients and the way patients interact with us, it's so different. And so my goal is to do a couple things. Number one, we've got to keep growing the program. We've got to stay comprehensive. We want to maintain that high level of excellence. But I have a second, and it's partly selfish. My second goal is that we want to take those dentists that we're getting left behind. And there are a lot of them, because in order to get to Spear the way it used to be is that, again, you've got to suffer those first few years, realize that, okay, I'm just going to make my way through it. And now after all the blood, sweat, and tears, I can finally do a quadrant of MOD BL composites. And while I still hate it, I can get it done. And then you get to that level where you're like, all right, I'm ready for advanced education. We want to catch them earlier. We want to meet younger dentists where they are today, because there's so many pressures. And whether you're going into a private practice or whether you're joining a group or DSO practice, it's all the same. New dentists need to be able to have a certain level of production, certain efficiency. And if you don't have that coming right out of school, it builds a lot of stress. And I see a lot of burnout from that. So we want to develop, or we have developed, a Jumpstart program, a GP Jumpstart program, where we can take these young dentists and say, okay, we want to show you, we want to teach you comprehensive treatment. We want to do those big cases that you want to do and show you how to do it. But let's get you where you need to be first. Let's get that hand skills, maybe some of the pearls that you need. Let's get you super efficient at doing the procedures that you're doing every day first. So we've got a lot of growth coming in that area. And then our final piece is that we know that learning has changed. Not everybody wants to get on a plane and sit in a classroom with a bunch of people over a couple of days. We needed to, and we are in the process of developing, which you guys are piloting for us. So thank you for that. But that's going to even keep pushing further as we move into blended education, where we're going to be having online components that we're going to be able to expand to have different exercises attached to them and learning objectives and being able to assess and being able to give people guided pathways. Not everybody's at the same starting point. And we want to be able to start where you need us to on the level of education.
I was privileged to work with my dad for 18 years as a dentist, and just side by side, and found, especially early on, it was critical to have him as a mentor and to help me. And I'd show him radiographs. I'd say, what would you do here? How would you treat this? That was so impactful for me in my career. I know you get to do the same thing for your son right now.
Yeah, so it's funny because one of the things I think that when we graduate, where we maybe lack a little bit, is really confidence, just being unsure. We all want to do the best we possibly can for patients. And the last thing any of us want to do is drop into a tooth that doesn't need a restoration or miss something that does. And what I see with new learners is that, or new dentists, is that they kind of want that second pair of eyes. Just help me be sure what I'm seeing is really what you're seeing, and moving along in that regard. And I'll tell you, it still chokes me up a little bit. The first time my son sat in an operatory talking to a patient, I was in the operatory next door to him, and literally I had to stop and catch my breath, because it was really it's so emotional just being able to see your baby move into that level of treatment and become somebody that's respected in our profession. But we do joke with each other, and we do mess with each other quite a bit. And for example, I'd come in sometimes to treat a patient, and he tells the patient, "Hey, are you really going to let that old guy touch you? That's like crazy." and then when I'm lecturing, oftentimes there's a high probability it'll happen. He's in my office today. I will get a text or a phone call where he's got a clinical question for me. And my favorite thing to do, he absolutely hates it, But my favorite thing to do is when I'm teaching and he texts me, I will call him back on my phone in front of the whole group. And I'm like, hey, Kevin, I have a great idea. I'm standing in front of 40 dentists right now. Let's just ask the whole group and get their opinion on it. And surprisingly,
yeah, he loves that.
cut down on the number of calls that he's reached out for.
Yeah, mission accomplished, it sounds like.
Yeah.
I was thinking about when I graduated, my dad would make fun of me because I'd be sitting there in room 4, operatory 4, and I'd be saying, well, you have an incipient carious lesion on the distal of tooth number 3, and we need to do this. And I would use the word discoid, cleoid, and I'd tell him what percentage of mercury is in amalgam and all this stuff. And he's over there just, I don't remember that stuff. Hand me the beaver tail or give me the spoon, like all these words he had created. And yes. I've learned over the years that you kind of have to actually speak more in layman's terms. But when I first got out of school, I was speaking all dental terminology. So I don't know if you've noticed that with Kevin or not, but
yeah, it's funny because as new dentists, we want to educate our patients as well. And I like the one piece of advice I gave him that has helped him financially with patients, getting them to do treatment is quite simply, when the patient says yes, shut the hell up and stop talking. Like, it's done, because dentists will talk themselves out of treatment because they just keep going. So definitely getting on terms with the patient that they can understand and simplify it. You don't have to prove to anybody how smart you are by throwing around a lot of terms.
What's the biggest barrier of entry you see to get the younger docs engaged with this education?
Part of it is logistics. You're young docs or you're new, you've got to be in your practice, and getting out of the practice and actually flying somewhere, that's really tough to do because it's how do we take time away? So we've really tried to minimize that barrier by having a tremendous amount of education that's going to be available online. Most of Frank Spear's stuff, Greg Kinzer. We want you to be able to necessarily go through a learning pathway and a curriculum without having to get on a plane if you don't want to. But not everybody learns that way. And we appreciate that some people need to hold it in their hands, especially dentists. We're very touchy-feely, and we need to make sure that we feel it and see it and do it multiple times. And so having somebody over the shoulder, we want to make sure that everybody has access to that. So, entry point, the kind of the new dentist is just really all about not having enough time, I think. I mean, really just taking time away from the practice is rough.
Yeah.
I noticed that with money too, like when I was a new dentist, I was like, well, I just invested all this money into my education and now I got to pay these student loans back. I almost paused. I probably shouldn't have, but I paused longer than I should have to then go on and invest in my own future education through CE spend. And I know Joe did the exact opposite. I mean, Joe was instantly out of school and getting his FICO, whatever.
How much more debt can I rack up here? Let's go.
Well, it's funny you say it that way, because at some point, all of us made the decision that we're willing to spend money on education for dental school, not a small sum, because we believe it is an investment that will pay off in our future. But somehow we forget that once we graduate. Mm-hmm. That investment that we make in ourselves and our education is something that absolutely pays off. And whether it is just a pearl that lets you save 5 or 10 minutes on a procedure, or lets you implement new technology or new procedures that you weren't doing previously, all of that stuff pays off, not just academically and not just financially, but something that we're also very proud of is our community. Dentists often practice in an island, probably less so for your guys, but to be able to have that group, to be able to have people come together and share stories, war stories, if you will, and have that support, have that network, we also feel is hugely valuable.
When I started Sarek at the beginning of my career, I was Red Cam, and then what's that old mill, the pre-MCXL? What was that one? Like the box, the cube. What do we call that thing?
Oh my gosh, it's just the scale.
I had one too. I even started with Sarek 2D stuff.
The compact mill, that was it. So that's where, and then the Vita blocks, that's where I started, right? And super lucky I had that out of the gate. But man, oh man, would I run into problems. And so getting on early on in my career on CDocs and, kind of crowdsourcing my problems was huge, because my other doctor in my practice didn't know. And so to be able to say, hey, this just happened, I have no idea what it is. and other docs say, oh yeah, this is how I handle this one. And so that was back then, and it's gone even like mushroom cloud explosion bigger now. The amount of information, and it's not always good, but the amount of information that's out there on your platforms is incredible to help new docs, right?
No, and I love that you said that, but a big piece of it, and whether it's on the CDoc side or on the Spear side, a big piece of it is that it is not Facebook. We monitor our sites very carefully. We make sure that people are treated with respect. We know how difficult this is, and we know that putting yourself out there with a question, the last thing that anybody wants to do is get a negative response. So we make sure that it is a safe place for people to ask questions. I was talking to a young dentist at Summit that just happened in Florida, and he had a clinical question that he asked me about a sinus lift. And we were talking about it, and I'm like, well, don't you have anybody in your area, like an oral surgeon or somebody you work with? And he's like, oh my God, I would never ask anybody in my area because then they're going to think I'm an idiot. And they're going to start spreading rumors about me that I don't do good dentistry. And so like there is that perception. So where do you go when things haven't gone right? Where do you go when you struggle with a procedure and need help if you don't have a community that you can trust that you can come to?
I think that's why Study Club is so amazing, Spear Study Club, because some docs are kind of on an island. They don't have the relationships that we have through Gen 4, where we can bounce ideas off of each other. I've flown to Joe's office and Bill's office. Bill Dorfman, he let me spend a couple days at his office, shadowing, and a lot of people don't have that opportunity to do that. And they're single practice. They don't have a dad, to go ask questions to in the operatory next door, and so they kind of don't have a mentor. I see the Study Club opportunity as a huge way once a month to gather, to be vulnerable. One of the cool things I like, even with a lot of the Spear modules, there's some of them they'll show things and say, this didn't go exactly like I wanted it to. Like if I were to do this differently, again, I would do this in this. I would do it differently this way this time. And you kind of get to see some of that in the Study Club, and that vulnerability helps, and you create mentors and relationships that are very helpful.
Yeah, that's such an important point. What's that saying that experience is what you get when you didn't get what you wanted? And I think that's where we learn the most. And as far as lecturers and speakers and people putting presentations on, speaking from experience, it's really hard to show your failures. All of us just want to show the best cherry pick cases that we can. But I think that one of the things we do quite well is we make ourselves a little bit vulnerable. And really that is where the learning happens. And no matter how good you are or how long you've been in practice, you are going to have cases that go sideways. And learning how to come back from that, maybe not even come back from it, but how to talk to the patient about it, how to recover on some level. That's just as critical as being able to have an amazing, beautiful case.
For you guys, then, in that piece with our newer dentists, what does success look like for you? What does it mean to say, hey, yeah, we're doing what I want to do here?
Success is such a difficult word, especially for new dentists. And the one thing that I've learned is that you're never going to be as bad as your worst patient thinks you are, or as good as your best patient thinks you are. You're always going to be somewhere in the middle. And it's important to give yourself a little bit of grace. It's important to understand that we all want to have successful procedures. And I'll take success from that level first and build it up from there. A successful procedure means that you did the best you could possibly do. And dentists beat themselves up about that. We've all done that. You go home and you're like, oh my God, that wasn't the way I wanted. I got an open contact. You kick the dog. You're just unhappy about the way things went. But what we need to kind of tell ourselves, even though we're always trying to achieve perfection, what we want to be able to do is know that on that day, on that particular patient, under these circumstances, that was the best I could do. Not the best that I can always do, but that was the best I can do. And that is the definition of success from a clinical perspective. And I think that, yes, we want to achieve and try for the highest levels, but there's so much, and I don't want to go off in a direction of mental illness and all of those issues that dentists kind of come under, but we put ourselves under a tremendous amount of strain. And so it's important that dentists are realistic about what success looks like. Moving on and looking at success from a more holistic approach. I mean, for me, it's being able to do what you do because you want to, not because you have to, right? You get to that level and you're like, well, I kind of love what I'm doing. I don't have to do this, but I love what I'm doing, and I'm making a difference. And that makes me feel successful. And building relationships with family, building relationships with peers and friends. I mean, all of that comes into it. So it's such a tricky question, because we sometimes see success as what we see on Instagram, right? It's just the pretty pictures.
Which is, totally nonsense, by the way. But sorry.
Yeah, go ahead. I just want to talk about Dr. Stanley's episode so that Dan will go back and listen to it.
Yeah, we actually did one on mental health.
Yeah.
He's a great guy. Love him.
Kyle's awesome. Yeah, he's a good friend. But I wanted to ask you, so on that note, I'm sure you've seen I forgot what they call it, but it's basically the emotional cycle of change, right? It talks about the uninformed optimist, right?
Yeah.
And then as you learn more, you kind of dip into this valley of despair, and then you start working your way out and become an informed optimist. And then finally, you get to where success is. So they call it the Dunning-Kruger effect, right?
Yeah.
How do you see that play into what you do at Spear?
Yeah, I mean, it's funny. It's sort of what I was talking about with those new dentists starting out, because it's, I guess, ignorant bliss is the way I like to describe new dentists starting out. You graduate because you just think you know everything and everything's great. And then you start getting into your first failures, and then you realize there's some pain here. I'm not sure what I don't know, but I know something's not right. And then you move along and you do it a little bit longer, and you realize, okay, it's still not going well, but now I'm starting to figure out where my gaps are, what I'm missing. And that's where we like to come in. It's hard to solve when you don't really know where your problems are. Our Jumpstart will kind of help with that. But when you get to that level where you're like, these are the areas where I'm really struggling on, this is where I can really use some help. That's when the education will bring you up to that point where, all right, now I'm starting to get it. When you go from knowing what you don't know to actually now knowing it, that's life-changing for people.
It's almost like the first step in Alcoholics Anonymous is like, admit you have a problem, right? It's
yeah.
Admit dental education is, I don't know everything.
Yes, but it takes a minute, right? We, as soon as somebody calls you doctor for the first time, you're like, I got this.
Yep.
I remember going to one of the first courses down at Spear was when Frank was teaching one on treating the worn dentition, I believe it was, and he said something about the same thing we said earlier. You can only fix what you see. You only treatment plan what you see, right? And so as you learn more about what you can see, then all of a sudden you might change your ideas about what's possible, even what the proper treatment plan and outcomes are. But he said something about attrition versus erosion, and he showed up all these pictures, and he said, this person sleeps on their left side and has acid reflux at night. And I'm like, what in the world? How did he figure that out? And then he started showing more pictures, and this person drinks soda, and this is how they drink through a straw. And he started going through all these things. And I realized that I went home and started looking at patients I had made night guards for that didn't even have attrition. They were wearing night guards because they had erosion, and I didn't diagnose it accurately. And so it really is kind of interesting to see how important it is to just, learn more and be part of more, and to continue to grow, and how that translates into better outcomes for our patients.
What you said resonates so much with me, because the idea of being able to it doesn't have to be an entire curriculum that you learn and say, okay, now I'm going to come home and I've just learned A to Z. That's wonderful when you can do that. But just being able to see one thing differently, just being able to open your eyes about the way you think and what you see, and such minor changes in the way you look at cases, they're life-changing in practice. We've all had that, right? You go to class somewhere and somebody points out some pearls. Jason Smithson, years ago, he was teaching composite, and I struggled forever with class 2 composites getting flash and not getting a good seal with the sectional band. He's like, just shove a little Teflon in there. And I'm like, oh my God, that's the smartest thing I've ever heard. Mm-hmm. And it's those little things that you see it and do it, and now it changes everything for you. Not to say that's the most important thing I've ever learned, but
no. But
I still don't love MOD composites, but I hate them or love them. Hate them less.
We do them all day long, so you might as well do them to the best that you can, right? And so anything you can learn to get better at it, yeah.
When you have the seasoned docs, right? And so, with that Dunning-Kruger effect, they're in the plateau of stability and sustainability, and you're just kind of on cruise control. One thing that surprised me about you is you're still practicing dentistry. You're still, in your practice seeing patients with, how busy you are and the role that you have was kind of shocking to me. But what do you recommend? What do you coach the doctors that are, in your situation? Like, what is relevant now versus what they've learned, et cetera?
Yeah, I mean, I would argue that very much of what I learned in dental school is not done this way. And I practice today very differently than the way I learned in school. And I think that the same, as long as I'm there tomorrow, it'll be somewhat different than the way it was yesterday. And dentistry is one of those things that can be incredibly fun and incredibly challenging and rewarding if you make it that way. In order to make it that way, it really comes down to looking around. There's nothing wrong with saying that I'm just going to do the procedures the same way every single time. And this is the way I've done it for the last 30 years. It's worked for me so far. I'll just keep doing it that way. And many of us do that. It's like, why would I change when what I'm doing is working? And the answer is it's just not fun. It's just not exciting. And you don't know what you don't know. When it comes to digital restoration of implants, I mean, doing all on X, full arch restorations, fixed hybrids, and being able to do those digitally now, I mean, the things have just gotten fun and easy and predictable. And I think that that's sort of one of the things that I've strived for in my practice, and why I keep trying to learn and keep trying to grow, is because I want everything to be really predictable for me. And I want it to be as easy for me and fun for me as it can be, because if it's easy and fun for me, odds are it's going to be easy and fun for the patient as well.
Years ago, I was talking with one of the other doctors in my office about complex dentistry and how comprehensive dentistry and how it can seem scary and it's sometimes unpredictable. And I joked that I wanted to just have on my tombstone one day a phrase that says, "Here lies the world's greatest single tooth dentist." And I kind of had that mindset that, I'm okay to just do this because it's not scary. It doesn't stretch me, but it's something that I can do every day. And then I fast forward now, years later. That was probably 15 years ago, and I'm still doing that kind of dentistry, but I'm also doing more comprehensive stuff. And last Friday, I did a case, probably the most severe wear case I've ever seen in my practice, where we had to open his vertical significantly, and we did a mock-up, and we showed him what it would look like, and we used Lucia jigs to create his bite, and we really did a lot of pre-planning with digital photography and scanning, and when the case was over, he was only in temps, but he left the office and he came back in about 15 minutes later, had tears in his eyes, and he just threw his arms around me and gave me a huge hug, and he says, "I cannot believe what you've just done." And I never got that when I did a class 2, no one ever gave me a big hug with tears in their eyes. And so it is really rewarding when you can change people's lives and make a difference for someone he's been asking me to tackle this case for 4 years. And I kept hesitating, and then some additional training and some more confidence that I've gained through my Gen 4 relationships, and honestly through Spear, finally gave me the opportunity to say, okay, I'm going to do this. And
it is life-changing. And I have to say that I was kind of like you. When I started, I wanted to specialize in crowns on tooth number 4. Like, that's all I want. Like, I feel like that's all I want to do. I'm pretty happy with that. But you get to a point, and so I made that mistake with Kevin a little bit, in that I feel like when he came in, I was just going to give him the easier stuff, and I was just going to take the more complex treatment, which on the surface sounds like a really good idea. In actual practice, it kind of sucks, because every patient you see tends to be a very difficult, challenging case. Otherwise, Kevin would be seeing them. But they tend to be the most rewarding ones, right? They're the ones where, you just go home, you just feel good. You've changed somebody's life. You've made a difference for them. And it really is life-changing stuff. We can't underestimate the fact that we are making a massive difference in people's lives. But to your point, you can't do that. And I hate to say cosmetics is everything, because it's not. But that's how our patients are going to perceive it. If they like the way it looks, and of course they like the way it feels, it's going to be a win. But if we don't understand how to predictably make it the way it's supposed to look and function, then there's no chance for success. We want to make sure people get there on purpose, not by accident.
So one of the things you talked about, Dan, is the evolution with Spear and the education and the training there. I think a big one, we'll call it a hallmark of Spear, has been the facially guided treatment planning course, right? And that's actually the first course I took at Spear, and that's now changed and it's evolved and has a new name. And could you speak to that a little bit and the why behind it?
Yeah, so facially generated treatment planning is something that Frank Spear came up with many years ago, with the idea that it's really important to understand where the teeth are supposed to go in the patient's face, right? Like, how many times have we done crowns on anterior teeth, and then we realize that, okay, now we want to do some orthodontic treatment, or you place an implant and then something changes. And now we realize that the crowns or the implant is not really in the right place for where we wanted the future treatment to be. And so it kind of lets us take a look. It kind of lets us break things down from a completely different approach than we've done before. We've changed the name to treatment planning with confidence, because really what it comes down to is, if you can't treatment plan properly, if you can't explain it to the patient, well, let me step back. If you can't see it yourself and understand it, and then you can't explain it to the patient in a way that they can understand, you could be the best treatment planner in the world, but you're not going to get yes. And really that's what it comes down to. And I hate to make it about financial, but that's all part of it. That's kind of what we're doing here. If you're not getting more patients to say yes than say no, you're not going to be doing this for very long. So as Frank loves to say, you can't treat what you can't see. So let's understand how to see it. And we want to make sure we chose the word confident, because that's really what it comes down to, is we want you to have something, a recipe that's going to be reproducible. They can do it the same way every single time. And you can confidently know that when a patient comes in, no matter the level of complexity, it doesn't mean that you'll be able to treat every level of complexity, but you'll certainly be able to see it, and you'll be able to diagnose it, and you'll be able to make the decision, where do you need help? Where does this need to be a team type of approach, or is it something I can handle on my own?
Is there a tool or a technology in your office that if I took away from you, you would just hang up the drill? Like, what is it? Yeah, what is it that you couldn't work without right now?
There's so many. Like if I had to, I don't know if I can narrow it down to one, but I can narrow it down to a couple. If I had to make a temporary crown again, like ever, I would be done. The fact that I can manufacture in my office, whether it's 3D printing or milling, but I can design and manufacture, that to me is something that I would just want to have the patience to go back and not do it that way again. So 100% if that was gone, I would be out of the office. Probably CBCT is the next thing, because how many times have we looked at 2D x-rays and you put, I'm going to watch that. Like, patient has vague symptoms, I'm going to watch that. And then, like, again, you take a CBCT and you're like, oh my God, I had no idea that was going on. So it's a little bit like Spear philosophy in that we're teaching you to see things that you just had no idea what was going on before. So I think those are the two things that I just would be out.
That's true. You take a PA of an upper first molar and you think, oh, that looks pretty good. And then you take a cone beam and it's blown out like an abscess in the sinus and you had no idea. Yeah.
Yeah.
Well, one of the things Craig mentioned, the value again of Spears, are the study clubs. Do you see those evolving or changing with your tenure?
I do. I mean, it comes down to community, and it really comes down to partnership. And so, who should be running a study club and who should be the study club leader? And I think historically we've done this with surgeons, not to say that that's not the best way to do it. And it is a wonderful way to do it. But there's so many other areas and so many places where it would be really nice to come together as a group. Maybe we need something orthodontically. Maybe we need something more on the implant side. Maybe we need something on CAD/CAM. I think that these kind of group discussions, they really need to evolve because they are so valuable. It's, again, having a safe place online is wonderful, but having also a local community that you can come to and feel like you've got support, somebody's got your back. And it doesn't matter what the procedure is. It doesn't matter how comprehensive or what the area of focus is. We've got that. So absolutely, it is something that we want to keep growing. We want to involve, but we also want to make it easy for people to be part of. And so that's going to be a big focus that we're going to move forward with. I can't share too much on that, but we've got a lot of really fun and exciting plans on the study club side.
Well, this has been super helpful. I was going to ask a final question that's more of a more serious question, but Joe, I don't know. Did you have one last thing you wanted to get?
The only one last thing I wanted to know from
Okay.
Dr. Butterman, since with his new role, almost 6 months in, what keeps you awake at night, Dan, with your new role? What are the things that you're most concerned about in our profession?
Yeah, well, those are two different things. My Portuguese water dog laying on top of me keeps me but no, I think the profession really it comes down to the stress in the life of dentists and the way that we live our day to day in our practice and the way that we sometimes consume ourselves with our practice. And I just really I want dentistry to be one of those things where, and I'm guilty of this, so I don't practice what I preach, but I would love to say that I do dentistry, that I'm not just a dentist, and that it becomes sort of this, it's just you're not completely defined by it. Because I see those stresses and I see that perfectionism. I want to help people grow where they need to grow, but I also want them to understand that, again, that sometimes good enough is going to be good enough. And I don't mean to ever imply that we're not going to teach the highest level of possible excellence that's out there, because we absolutely want to make sure we have that. And we want people to know that you can get to that level if you want to. But not everybody wants to be the next Frank Spear. Not everybody wants to be a Greg Kinzer. They just want to be a really good dentist, and we want to help you with that too.
And that was going to be my last question. So that maybe that's the answer. But for those of us who do want to grow in our clinical skill set, and obviously we're lucky because we have this connection with Spear Education that's deeply intertwined in what we're doing as a company. But what would you say is one action that we could take today? Like what is one step that dentist can do today to just kind of up their game in their dentistry?
Pick something that you don't like. And I say that because probably if it's a procedure that you love, you're already doing it quite well and you're already making some really good money with it. We tend to like the procedures that pay us the best and that we're the best at. But there are so many things that it doesn't take much tweaking to get you where you need to be. And I'll just take an example of endodontic treatment. Many people that I talk to will say, like, the last root canal I did was in dental school and I never want to do it again. I hated it. It was a miserable experience. But everything's changed so much. So I would say re-engage in an area where you feel like you don't love it and you're struggling with it. Find your weakness and just start with Spear Online. Take a look at some of the videos on that content, do a search, and just see if something's going to resonate with you. And if it doesn't, great, move on. That's not an area that you need to keep diving any deeper. You don't need to force yourself to go down that path. But oftentimes it becomes something that re-energizes and reinvigorates you. And you're like, you know what? I was totally wrong about what I thought that this was, whether it's implant placement or whether it's implant restoration or endodontic treatment, clear liners, or I never can imagine that I can prep 14 teeth in one appointment. Those are the kind of things that we want people to be able to look at and feel confident that actually they can move in that direction. But you've got to take that first step. You've got to take a look and start learning, and it's one step at a time, and be patient with yourself.
Yeah, that's a great answer. And all of our doctors, those that are listening right now, have access to Spear Online. Everyone, if for some reason you can't think of your login, shoot me an email or a Teams chat, and we'll make sure we work with Amy Fletcher and Amanda McMains to help you get, and Michael Gonzalez, who helps us a ton, in order to get you all set up. And starting with Spear Online is a great way. There's so much content on there. It's a great way to get started.
And I'll just say that I've worked and spoken with a lot of different groups out there. And I have to say, I hope your dentists know how lucky they are to be with you guys. I mean, you guys care very much. And your goal is you want people to be great. And you do a lot to make sure that they are. And the support you show your doctors, that's not common out there. And I just hope the doctors listening understand what an unusual environment they are and that they're in, and that they really appreciate that, because we certainly do from you guys.
Oh, thank you.
Yeah, appreciate it. I mean, we are so lucky to be working with a group like you that aligns with our values, right, of what we're trying to do and pursuing excellence and supporting doctors and providing best level of care for patients. So thank you for your time, Dr. Butterman, and for being on with us and for the partnership and being, part of our process and our journey as well.
Of course. Thank you, guys. I appreciate it.
Thank you.
Have a good one.
Appreciate it.